press briefing on updates of COVID-19 cases. With us today are Professor Lo Chung Mao, Secretary for Health, Dr. Zhang Chokwan, Head of Communicable Disease from Health Protection Center, and Dr. Riley, Chief Manager from Hospital Authority. Professor Lo will say a few words before Dr. Zhang and Dr. Lee give us updates of HA and the number of cases. Professor Lo, good afternoon, friends from the media. Since the situation has eased since the fifth wave in May, in March, the number of cases has started to climb up again. In the past 2 weeks, we have seen the number of cases rising from 2,000 odd per day to over 9,500 cases yesterday. The administration attaches a lot of significance to the current situation. Apart from the increase in the number of confirmed cases, our healthcare system in general is under pressure. We've also seen an increased number of critical cases and fatalities. The total number of admissions has risen, and this has led to occupation of hospital beds by COVID patients. And the number of staff members who are confirmed also increases. That would affect some of our services. And medical services for non-COVID patients are being affected. We will not lay flat. We will explain to you new anti-control measures to you. Before I do so, I will ask Dr. Larry Lee and Dr. Zhang Chokwan from the HA and CHP respectively to give us an update of the latest situation. Dr. Lee, good afternoon. HA has got 2,324 confirmed inpatients. Among them, 322 are newly confirmed patients. For those in isolation facilities, 547 are in isolation ward, 183 in Tier 2 wards, and 612 in infection control center of NLH. 16 are being treated in AWE COVID treatment center. Among them, 245 are newly confirmed patients. Another 9 patients are reported critical. 2 has got 3 jabs, 5 and 2 with no vaccination record, and 2 are in serious conditions. We have 40 critical inpatients and 24 serious patients. 13 are being treated in ICU. For deaths, there are 7 new cases of death reported, all male, aged between 79 and 95. Among the 7, 4 have not been fully vaccinated. 1 came from a care home. A 79-year-old male with 3 jabs, with dementia and also lung diseases. On the 9th of August, he was transferred from isolation center of AWE to A&E of Northland Hospital. He was found to have pneumonia and also fibrillation of his heart, and his condition deteriorated and passed away on the early morning of the 25th. An 82-year-old male with 3 shots of vaccine, suffering from renal failure, requiring dialysis, also suffering from heart disease and diabetes. On the 22nd of August, he was admitted at the A&E Department of PMH. He tested positive both by PCR and RAT. He had a fever, and also his lung was opaque, and his oxygen level continued to worsen. We gave him steroid as well as oral drug, but he passed away on the 25th. 81-year-old male with no vaccination record, with problem in his heart and fibrillation and suffering from lung cancer. On the 19th of August, He was admitted through any department of Characters Medical Center because of fever and cough. And then he tested positive by RAT and PCR. His lung X-ray was opaque, and then his situation deteriorated and passed away on the 25th. A 95-year-old male, no vaccination record with hypertension. On the 1st of August, he was admitted through an A department of QEH because of low oxygen content, and also his CT value was 17.5. His vital signs continued to deteriorate. He passed away on the 25th in the evening. The remaining three, their deaths may not be directly related to COVID. The fifth is a 90-year-old male with 2 vaccines with renal disease and dementia. On the 8th of August, he was admitted through any department of QEH because of coughing and fever. His wife tested positive by RAT. This man's RAT was negative, but then he was positive by PCR on admission. He was transferred to ICC of NLH for treatment. On the 16th of August, he was found to have palpitations at AWE. He was transferred back to QEH. Oxygen was required, but his condition continued to worsen, and he passed away in the evening of the 25th. A 78-year-old male with 3 shots. He was found unconscious at home. He was taken by ambulance to QMH for resuscitation on the 25th. Upon arrival, he was given resuscitation, and he was PCR tested positive, and he passed away on the 25th. Another 80-year-old male with no vaccination record, with hypertension, a history of stroke and coronary heart disease. He was admitted through an A department of Two Moon Hospital on the 23rd because of a brain injury. Bleeding was found in his brain, and he was PCR positive. His situation continued to worsen in the geriatric ward because of his brain situation, and he passed away on the 25th in early morning. 224 patients got well in the past day. 198 have been discharged. 10 confirmed via admission screening, and 14 patients are listed as close contacts, with another 149 employees confirmed. Another 86 employees have returned to duties. Now, in the geriatrics and also medical ward of Two Moon Hospital, a 73-year-old male tested positive on the 21st. Contact tracing found another 5 patients aged between 58 to 77. They are all being treated in isolation, and the ward will not admit new patients, and no visitations will be allowed. A thorough cleaning and disinfection has been done. That ends my report. Dr. John, yesterday we had a total of 7,665 confirmed cases, 2,228 positive by PCR, 5,457 positive and verified by RAT, 170 imported cases, 138 tested positive by PCR, 32 by RAT. Among the 170 imported cases, 35 were picked up at the airport. On days 1 to 3, at quarantine hotels, 38 picked up. In community testing center, from days 4 to 7, 63 cases. Those picked up on day 8 to 10, 14 cases. Most of them have higher CT value, so they are likely to be repositive cases. Among the 170 cases, they are from 38 places. The UK, 22 cases, India, 19, the Philippines, 18, and USA, 15 cases. The remaining 34 cases imported less than 10 cases to Hong Kong. There are 7 cases of death. So we have a total of 9,437 deaths. 5 care homes have reported cases to us. Tonghua Group of Hospitals, Hui Lai Guen, Anlo Yun, 1 resident confirmed. 3 residents and 1 staff member under quarantine. Chuk Lam Ming Tong, Wuli Ono Yun in Southern District, 2 residents plus 1 employee confirmed. 6 residents have to be quarantined. Dawa Wulou Yun, 有限公司 1 resident confirmed. 7 residents have to be quarantined. 均益護老中心 in Tuen Mun, 1 resident confirmed and 2 have to be quarantined. 星空會護老院 1 resident plus 2 employees confirmed. 4 residents have to be quarantined.
For schools, today we've got 67 schools reporting 116 cases. They include 74 students and 42 teaching staff. They come from 37 kindergartens and nursery centers, 12 primary schools, 18 secondary schools. In the past 7 days, 24 schools had reported 2 or more cases. And we have recommended the following 7 schools to suspend classes for 1 week. They are in the Yao Chimong Street, Weishi Kindergarten, K2A class. It has 22 students, and 2 students and 1 teacher were infected, and the class need to be suspended for 1 week. Poshan Nursery Center in Jardines Lookout, K1 Blue Group. It has 14 students. He reported 2 students and 1 teacher infected, and yesterday and today 2 more students were infected, so the class was recommended to be suspended. Another kindergarten, K2F, which has 28 students, in the past few days, it has an accumulation of 5 students who tested positive, so the class has to be suspended for 1 week. Church of Christ, China Church of Christ, 2 Light Kindergarten in Yunnan, a class with 30 students. It has 1 student and 2 teachers infected, so it has to be suspended for 1 week. Wang Chi Kindergarten in an outlying island, PM class with 16 students. It's got altogether 3 students and 2 teachers infected, so class has to be suspended for 1 week. St. Catherine's International Kindergarten in Hong Kong, it's got 2 classes. One is nursery P, PM class, and another nursery Zebra class, also in the afternoon. Each has 25 students. Among them, in the Hippo class, 3 students were infected. In the Zebra class, 2 students plus 1 teacher were infected. And these 2 classes, their classrooms are just right next to each other. They have to be suspended for 1 week. Maylock Bilingual Kindergarten in Tuen Mun, K3B class has 21 students. 3 students of them have been infected. It needs to be suspended for a week. Around there's a school, Stanford American School in Kowloon City. It is a secondary school. It has a 7R, ENR class with 18 students, and it was suspended for 1 week since August 22. In the past few days, it's found in other classes, 13 other classes with infection cases. And each class has infection ranging from 1 to 3 cases. So the total number is 22 students and 2 teachers have been infected so far. So this school has a total of 390 students and 75 teachers because of its large number. So there could be a risk of transmission within the school. So the whole school has to be suspended for 1 week. And there's a variant on the August 23rd of the samples collected. 45.5% of the cases were suspected to be of BA4 or 5. Most of them were BA5. So there is an increase in the proportion. BA 2.1 remained at 7.8% in terms of its proportion. So, Secretary, please brief us on the latest anti-pandemic measures. As Dr. Lee and Dr. Chuang just reported, the figures can show to you that our infection load has exceeded 4,000 for consecutive 3 days. The R0 reproductive number has risen from below 1 to The latest is close to 1.44. In other words, it has bounced back to the level where the caseload can double in 2 weeks. So that leads to our anticipation that the number of caseload could exceed 10,000 or even continue to rise further than that. In that light, and with this increased seriousness of the pandemic, our medical system is facing increasing pressure. And Dr. Lee has said that our number of patients admitted into public hospitals and the usage of beds and also the rising number of infection among staff would actually pose an impact on our healthcare system and services from 30% to up to half of our medical services. Under this situation, in light of the development of the pandemic, the government needs to decisively adjust our precautionary policies. Let us stress that the government has also considered the public's livelihood and the impact on the economy. We hope that we can go for policy with the lowest cost and with yet the highest effect. In order to more effectively monitor cases in the community to protect high-risk groups, to prevent them from being infected or create or lead to serious cases resulting in the need for hospitalization, the government would maintain some tightened criteria for at-home quarantine so as to strengthen our management of confirmed cases. All family members belong to high-risk groups, like family members, people with chronic diseases, or toddlers, babies. If they cannot find appropriate spaces in the home, for example, independent or separate toilets, then these close contacts of families will need to be sent to quarantine facilities. We're particularly concerned about the elderly who actually have not been fully vaccinated. We want to issue a strong appeal to those aged above 70 and have not yet received any vaccines or have only received one jab. They should be sent to community isolation facilities designed for the elderly. Our figures indicate that those above the age of 70, if they only have received one jab or less, then their death rate after being infected would be 5% at the minimum and as high as 16%. Because of the high risk this age group faces, we hope that they or the family members can understand that they should be quarantined and placed under observation and be treated with drugs as soon as possible. And I will urge the public to cooperate with the government, that is to act upon receiving the quarantine order, to receive the arrangement to send them to community isolation facilities. If needed, our law enforcement authorities could take action. And secondly, the government all along has hoped to enhance our testing capacity, particularly PCR testing, so that within a short period of time we can identify the confirmed cases and then quickly stop the spread of the virus within the community. In the past week, across Hong Kong, the community testing centers and mobile sample specimen collection stations on a daily basis carry out 140,000 tests a day, which is 3 times the load in June. With the change in the pandemic, we would increase the number or the issuance of compulsory testing notice and the enforcement action taken as a result of that. For example, to increase random checking of buildings placed under compulsory testing notices and issue the testing order to people under quarantine or notices of fixed fines to them.
Furthermore, to enhance protection for residents of care homes, patients, and healthcare staff, now these people we want to protect in particular. We will enhance the frequency of PCR for high-risk groups. We've already announced that workers of all residential care homes for the elderly and the disabled should be done on alternate days. And then there should be more support for these care homes. We have 1,100 of them, and contractors will be arranged to collect samples from them on a regular basis. HA has so arranging for more frequent PCR tests for our staff with the ultimate goal of having PCR tests on alternate days and to lower the risk of scheduled premises and catering premises because they involve mask-off activities. To balance the need of the community and also the need to prevent the disease, we will enhance the testing arrangements starting from the 28th of August, i.e. this Sunday. We are going to tighten the requirement for RAT. Right now, it's only applicable to customers of bars. They will be extended to all guests of banquets. Before entering a banquet premises, all guests are required to have done an RAT within 24 hours and to produce an image of a negative RAT result for inspection by persons in charge at these premises before they can be allowed in. And many residents, for various reasons, might have already conducted PCR. And if a PCR result is available and done within 48 hours before entry into a premises, then the negative result can replace that of an RAT negative result. The testing requirements applicable to staff of catering premises will be extended to all employees of scheduled premises. Within 3 days of entering such premises, an RAT negative result is required. And I'd like to appeal to the public because of the serious situation. Starting from today, you should do RAT more often. In particular, if you have to leave home and attend activities, cross-family gatherings in particular, you should do an RAT so confirmed cases should be picked up as soon as possible and to cut transmission chains in the community. Based on the risk analysis of sewage surveillance program, we will issue more RAT kits to high-risk groups, including the cleansing workers, the property management agencies, etc. And we will also distribute RAT kits to the disadvantaged groups in society, including the elderly persons. I'd like to stress, however, that RAT has its restrictions. Those who have symptoms should not refrain from seeing a doctor merely because of an RAT negative result. A person with symptom may have an RAT negative result. They should not take part in gatherings because that can lead to an infection. To ensure that these tightened measures can be enforced effectively, together with the Security Bureau and law enforcement agencies, we will step up enforcement of these requirements, including confirmed patients who have a red coat. We will check on whether they have left home during the period, and we will enhance checking of persons with an amber or red code from entering licensed premises and will enhance the inspection of black spots in the past week. Now, we have already take enforcement action in 66,000 times in scheduled premises. 11 fixed penalty tickets have been issued to persons with either a red or amber code, and also 4 prosecutions have been instigated against person in charge of these premises that have not complied with the requirements. We will also check vaccine pass records, and for those who have violated the requirements of vaccine passes, now we will take follow-up action against these violators. So I'd like to appeal to the public for those who are confirmed and those who are high risk, for the sake of yourself and also everyone in Hong Kong, do not try to break the law for expediency's sake. Now, there are questions on whether the current increase in the number of cases is related to the relaxation of quarantine requirements. Now, let me show you some statistics. Since the introduction of new quarantine requirements on the 12th of August, that is the 3+4 requirement, we have an increasing number of new arrivals, but the number of imported cases have been steady. We have on average about 195 imported cases per day. The number of inbound visitors has risen, and yet the number of imported cases per day remains the same. That means the percentage of imported cases has dropped. Percent or so. And after 3 days in a quarantine hotel, the percentage of positive cases identified is more or less the same as the figure before we implemented the new quarantine requirements. It's been about 70% or so. And then for PCR tests on day 6 and day 7, and also those identified by RATs, they've been over 90%. So the figure is more or less the same as the level before we introduced the new 3+4 requirement. Now, these people are still subject to the amber code requirement, and they should not enter high-risk premises. Since the implementation of the 3+4 quarantine requirement, infection risk in the community hasn't been affected. But then the administration will keep a close eye on the situation. Whether we are talking about the number of local cases and imported cases, we will adopt a scientific-based principle, and we will be targeted and specific to control the risk of importation of the disease. After all, we will have to rely on the statistics. And let me appeal to the public. The pandemic situation, the number of confirmed cases is on a rising trend. There is no ruling out that the number of cases per day will exceed 10,000. So do not lower your guards. Fighting the pandemic is not just the responsibility of the government and the healthcare personnel or quarantine requirements. It is the duty of everyone in Hong Kong. Let's all chip in. During the period, reduce the number of gatherings and cross-family meetings. If you have any symptom, do an RAT as soon as possible. And even if the RAT result is negative, do not join meals or gatherings and banquets. These are mask-off activities, and then you should seek a doctor as soon as possible and administer tests as suggested. And if you are confirmed, you should be treated as soon as possible. Now, we need to be united so that we can stop this rising trend of cases, and we can also alleviate the burden on our healthcare system so that non-COVID services can resume to normal as soon as possible. Otherwise, the government would have no choice but to further tighten other social distancing measures. Thank you.
Thank you. Now's the time for question and answer. So please use the mic passed to you, and please don't ask more than 2 questions each time. And please let us know which media outlet you're from before you ask. Thank you. The gentleman at the back, secretary from cable TV. You just now mentioned that the proportion of imported cases resulting in infections has not increased but dropped to under the 3+4 quarantine policy. So would you in a short period of time consider the 0+7 policy? And also, experts have said that it's meaningless to look at the number of confirmed cases each day. What do you think? The government will continue to review the quarantine arrangement for inbound travelers. The 3+4 policy has only been implemented for not a long period of time. So we'll look at the actual data and also see the development of the local pandemic before deciding on what's the next step ahead. The government will continue to optimize the quarantine arrangement for people coming into Hong Kong. Next question. Second question. The second question is about whether it's no longer necessary to report the number of cases every day. As I stressed just now, figures themselves have their importance because the rising numbers undoubtedly would affect infection of people, even though many cases have only mild symptoms. But in our community, there are still significant groups who have not been vaccinated. After they're infected, they would face a serious risk, like those aged above 80. 30% of them have still not been vaccinated. Should they become infected, the risk of death is up to 16%. So we should not neglect that. And also, as the overall number of cases rises, the hospital authority would be under heavy pressure. So for the time being, we would stress that the numbers themselves are important. Next one. Lady on the right.
I'm from Bloomberg News. I would like to ask Dr. Low, cases are rising, but serious disease and deaths
Sorry,
remain.
your mic is not working well. I can't hear you.
How about now?
It doesn't seem to be working. Your mic is not working.
Is this better?
Yeah.
Dr. Low, cases are rising, but serious disease and deaths remain low. Why should people and the government be concerned, given that that's the situation everywhere in the world now, such as in Singapore? My second question is on the return of social distancing restrictions would be seen as a step backwards for Hong Kong as other places are moving ahead with living with the virus. Will the government seriously consider introducing more restrictions if the cases continue to rise, and how likely is it? Thank you.
I've repeatedly emphasized that we are different from other countries. We're glad that we are different from other countries in the sense that, for example, UK has suffered a very high casualty during the COVID pandemic. There are over 200,000 deaths in UK, with the population translating into Hong Kong, we should have a mortality of over 20,000. Now, we certainly don't want to copy that. Having said that, I think we have to understand that we have the situation in Hong Kong is different from Singapore. Now, first of all, we have a much more aged population. We are a victim of our own success because we have the longest longevity in the world. And unfortunately, the vaccination rate in our elderly is still lagging behind. As I mentioned just now, nearly 30% of our aged people over the age of 80 have not received a single shot of vaccination. And if they contact COVID, their mortality rate is in the region of about 16%. And we have to learn from history. In the first wave, we do suffer a serious situation with a high mortality. We have over 9,000 deaths, and the whole public healthcare system is overwhelmed. So I would urge you, anyone who said that we can easily live with the virus now as other countries, I would submit to say that I cannot agree to that. As a responsible government, we have to protect the health of our people, even though they are our elderly. Every life matters. And we can't say that since they are old and weak and they are the minority, we can ignore them.
And the second question is about social distancing measures. The second question is about imposing more social distancing measure.
Sorry, I can't hear you.
Would you please repeat your question, the second question?
So my second question is about would the government consider introducing more social distancing restrictions if the situation gets worse, and whether that's a step backwards for Hong Kong?
No, I've already mentioned. Now, we cannot promise that there may not be other social distancing measures. In fact, if you look at the whole world, now there are different emerging diseases coming up. From SARS, to the avian flu, we have different Ebola virus. We have different emerging disease coming up. And then this COVID came up 2.5 years ago. Nobody can imagine that it would stay for so long. And now we also have, the monkeypox, right? So there's no reason that the government can promise that we will not introduce other measures to control emerging infectious disease, right? The COVID is still mutating. We are seeing new mutants coming up. And in case there is a more virulent COVID coming out, mutant coming out, we cannot guarantee that there may not be other social distancing measure to control the pandemic or another new emerging disease.
下一位，呢邊第三行男。
The other one, this lady in blue. I'm from Phoenix TV. Just now you announced a new measure that is for elderly who have not been vaccinated to, if should they be infected, they should be sent to isolation facilities. But these elderly, they may have chronic diseases. So for those placed under isolation, what about the medical equipment and healthcare workers? Would they be able to cope with their medical needs? And also, do you think the new measures could be effective in controlling the pandemic if the result turned out to be not useful? Then would you have other plans in the pipeline? And also in November, we're going to have an Asian Financial Summit. Well, now that the number of cases remain high, would you consider trying to suppress the number of cases before November? So would you let the people attending the summit be exempted from the quarantine requirement?
这个问题
There are a total of 4 questions. The first is about the elderly. We understand that they have underlying diseases, and that is exactly why we are not comfortable with leaving them at home. We are doing it out of consideration for their health. Through daily press briefings, you might have already noted that the residents in care homes, the vaccination rate is rising. 95% of them have been vaccinated, and 83, some 50% of them have got 3 jabs. But then our elderly in the community are not as highly vaccinated. Some 40 to 50% of them have never been vaccinated, and that is exactly our worry. And if they have underlying diseases, then they are even at higher risk. So our suggestion here is for their own good. If we leave them in the community, our hospital authority has got this new arrangement for those who are over 60 and confirmed. The HA will contact them and prescribe them with oral COVID drugs. But then if they stay home, they may not be properly monitored. And we've seen many cases of elderly confirmed patients with their condition deteriorating very quickly at home, and we're not able to give them timely treatment as a result. So may be a bit inconvenient for elderly persons to leave home for isolation, but that is for the sake of their health. In considering these new measures, we consider both the effect and also the overall impact on the community and the economy and the cost to the community. Now, all these measures are, after careful consideration, regarded to be effective. We have other social distancing measures which may come at a higher cost. We don't want to resort to them, but they are still on our list. Depending on the development of the epidemic, we may introduce other measures. Of course, this is not something we want to see, but then we have to take into account the overall health of the community. I'm not just talking about COVID patients, but everyone in Hong Kong who needs services of the HA, i.e. our public healthcare services. We have to understand that 90% of our residents are using specialized services provided by the HA. About 70% of the HA's services have been affected by COVID. Further on, the figure may rise to 50%, and everyone in Hong Kong may be affected. So hopefully, the existing measures can lower the impact on the HA. And as for the conference in November, from the perspective of fighting the pandemic, we do not have a particular deadline in mind. We do not have specific targets to be achieved by a certain date. Our intention is to control the epidemic and to suppress the RT as soon as possible. Now, if the RT is lower, then the number of confirmed cases will fall, and then it will be within the situation will then be within the control of the HA. That's the best. As for the fourth question, that is major conferences or events to be held in Hong Kong. Now, the government does consider their importance to our economy. Some of them may be exempted, but then we have to consider the development of the epidemic. I hope each will ask no more than 2 questions so that more journalists will have a chance.
First question, would the government plan to tighten hospital entry requirements now that the government have repeatedly mentioned that the healthcare system may be overburdened? And could you reveal more details on how, the percentage of each day's confirmed cases entering the ICU and whether the government would plan to tighten that in order to free up more space for other services? Second question, in following up on Professor Lowe's comments on whether the infection situation would affect, events and further opening up, is the rising trend going to affect the government from further opening up the city now that you're mentioning the possibility of social distancing measures? And at what point would the government plan to tighten social distancing measures, and what sort of measures are they? Thank you.
Dr. Lee, like to answer on behalf of the hospital about these admission policies?
Okay. About the admissions, now we have to focus on, I think, a few perspectives. The firstly is the absolute number. And now the admission number, which is rising from around 250 to about 350 nowadays. And actually that will create a significant pressure to the hospital system. And you asked about the intensive care, and actually the occupancy was increased from around 45% to now 54.7%. The percentage looked like it's not a sharp increase, but the absolute number also a great burden to the public health system. And also you can see that we have now more than 2,300 patients within the public sector, which is the COVID patients. And we have to spare our manpower and also some staff deployed there to look after for nearly 800 patients in the Hong Kong ICC and also in the Asia World Expo, the COVID Treatment Center. All of these bed mobilizations and also the increased number in the admissions together with the staff deployment will create a great hinder to our flexibility and our capability to handle cases which is non-COVID.
I don't think there is any reason to keep on arguing that the COVID is not putting strain into our hospital healthcare system. The data is all there. 2,300 beds occupied by COVID patients, more and more ICU beds, and deaths as well. And even opening up our AWE treatment center, and we have sent staff there. So whoever say that the current COVID situation is not hurting our healthcare system, that is fake news. Your second question about the rising trend upsetting the government in further opening up. I would say that the rising trend should upset everyone. Even though, some of the people may not be affected. Some of you feel that the disease is a mild one. It doesn't affect you. It doesn't affect your health. It's affecting the health of our fellow citizens, especially the elderly and some young kids. We have deaths of young kids. And we remember that we have just started the vaccination for our young kids from 6 months to 36 months. So I would say that the rising trend should be upsetting everyone in Hong Kong. And before we can control this uprising trend and relieve the pressure from our healthcare system, further opening up is not a realistic option at this point.
好，下一位，呢邊第三行白色恤衫嘅男士。
This man in the third row from Now TV. Well, we've seen the surge in the number of infection cases. What does the government think of the current trend in relation to the pandemic? And among the confirmed cases, what is the percentage of suspected cases? Would that imply a continued rise in the infection cases? Recent days, we've seen a rising number of government officials being infected. What is the source of transmission? Do you think a need to get, for example, civil servants to work from home? Maybe the secretary can answer the first question on the trend of the pandemic, and Dr. Chuang can answer the question on infection among civil servants. Maybe Dr. Chuang can answer the question on reinfection. I can comment on the case of civil servants. Reinfection is about 1 to 2%, so a slight increase. Previously, it was below 1%, but it still makes up a very small number of the overall tally. Well, we are concerned about the, particularly the infection among senior government officials in recent days. Well, this actually ties in with the overall increase in infections within the community. But of course, we would particularly be concerned about, large outbreaks within government departments. So we have already stepped up within the CGO, central government offices, testing of our colleagues. But besides RAT, we are recommending colleagues to carry out PCR tests twice a week, so as to ensure that the brain of the government will not be seriously affected or to have a major outbreak within the government due to the pandemic. The government has not considered arrangement for work from home yet, but depending on the changes in the pandemic, we're open to all sorts of new measures. In the third row, lady in the black vest. I'm from Hong Kong Economic Times. Strengthening measures. What sorts of gatherings are you targeting? Will wedding banquets be included? And would the organizers of banquets or caterers be responsible for carrying out monitoring? And what about elderly people? If they cannot provide you with RAT pictures, what would you do with them? And people age above 70, those who have not received more than one jabs, and if they're classified as close contacts, how many of them you think expect to be sent to isolation facilities? When would you implement the compulsory isolation? And have you also discussed the particular measure with government experts? I think you've asked a number of questions already. And also, can you elaborate more on the criteria on when you would tighten these social distancing measures? And also, Professor Yun also said that it's really meaningless to tighten the distancing measures even in the light of rising cases. What do you think? I think I've counted that you've asked actually 5 questions, so I can answer the first 3 of your questions first. As for definition of banquets, there is a definition for it. That is gatherings involving 8 people or more. That is more than 2 tables, because now each table can accommodate 8 people at most. So if you have 2 tables or more, then that would be considered as a banquet. As for who is held responsible, well, the responsibility lies with people going to the premises and also the person in charge of the premises. Those entering the premises are obliged to carry out RAT, and the people running the banquets, the premises, are responsible for checking whether these guests have proof of RAT, like in the form of a picture. As for elderly people, if they don't know how to do an RAT, actually now RAT are commonly used across Hong Kong, and the government will have taught the public how to use RAT or do it through the media. If there are elderly people who don't know how to do it or have not tried it, I think that family members should try to, for people who don't know how to do the RAT, family members should not let them go to a banquet by themselves. I think there should be family members accompanying them or taking them to the premises of the banquet. And I'm sure the people running those premises should be able to look after these elderly. And if the old person involved has not done any RAT, they can actually do the RAT at the spot, right at the premises. So I've answered 3 questions already. So we can answer 2 more questions from the press. This lady in pink. And from TVB. Of the measures you mentioned, you said that those in the high risk would need to be isolated. Are you worried that this would cause people, out of fear of being isolation, do not report their infection to the authorities? How could you avoid that from happening? And also, private hospitals admitting patients with COVID, have you experienced or seen any difficulties there? How are you going to deal with it? And also, just now you said if there's no choice available, then you would tighten the social distancing measures. But what are the criteria? I didn't get the 3rd question clearly. Just now you mentioned you have no choice, you might tighten the social distancing measures. But what are your indicators for tightening the measures? Whereas I would need to look at the overall situation, not just based on the number of cases alone. We need to consider, above all, the maximum pressure that the health authority can handle. It's not just based on rising number alone. Now, you mentioned for high-risk individuals that they may not report their cases or infection to the authorities. Well, let me stress that it's the responsibility for everyone in Hong Kong to fight the pandemic. There's also regulation, CAP 599, regulating, what people should do. People infected could pose a risk to the entire community, and so that poses an impact on our efforts to fight the pandemic. Let me call on everyone in Hong Kong, please fulfill your responsibility, live up to your responsibility. I believe that Hong Kong people are of high quality, and I don't want to send any message or to have any message sent to anyone at high risk not to report their infection to the authorities, because once they have reported their infection, our colleague can provide them with online treatment or deliver drugs to them, or if needed, they can be delivered to isolation or treatment facilities where our colleagues can monitor the health condition and provide appropriate treatment. As for private hospitals, let me say this. Just now I stressed that we're facing increased pressure, for the public healthcare system. And we have the public system and also the private healthcare system in operation as well. But the public system is coping with close to 90% of the hospital needs of Hong Kong people. Under the pandemic, HA colleagues are facing tremendous pressure. You've just heard the figures we told you. Undoubtedly, they're facing tremendous pressure. Under the pandemic, we've mentioned that the corporate responsibility, so as and conscience. Well, in terms of the medical system, I would use the phrase professional responsibility. I hope that our private hospital sector will fulfill their responsibility. I know that there are issues concerned, but in the face of such a pandemic that affects our health and safety, I would stress that there are more answers than questions now, and we can provide professional answers to the problems we face. As a professional medical practitioner, I don't want to have to resort to the media to try to provide solutions. I hope that our colleagues from the private sector can be more proactive in helping our colleagues in the public sector. Many colleagues in the private hospitals used to work in the public system. They definitely know the manpower shortage in the public system. The shortage already exists in relation to manpower. I don't need to explain to them at all. Many of our colleagues in the private sector used to work in public hospitals, and they were trained there and worked in the public sector. Even, those in senior positions in the public hospital and also in the private sector, they may have held senior positions in the public sector. So they must be able to understand the pressure facing our colleagues.
Although there are problems and maybe communication has not been that good, but the data can speak for themselves, as I often stress. And as I say, this government is result-oriented. The 13 private hospitals are going to provide 364 beds, but only 202 beds are in use. That is 55.5%. 5 hospitals has this utilization rate of over 60%. The highest has got over 90%. There are also 3 hospitals with 0%. Not even one patient has been accepted, and some is only around 10-20%. Now, if we adopt this result-oriented approach, now, if the problems lie with patients, how come some hospitals can accept up to 90%? Now, if we take 60% as the passing mark, then I will say that only 5 out of the 13 hospitals have passed. I hope we can resolve the problems as soon as possible through cooperation. I hope private hospitals can contribute their share in this fight against the pandemic and to help the many patients in our public healthcare system that require hospitalization. So the 364 beds, only the medical center of CU accept COVID patients. Only 24 beds there accept COVID patients. The other beds are not for COVID patients. Private hospitals have taken into account their capacity to treat or capability to treat COVID patients. So the agreement with the hospital authority is to accept non-COVID patients to alleviate the burden of HA staff. I hope that the utilization rate can continue to increase. 364 beds is not our final target. We hope that it can rise to 1,000. And this figure has been mentioned, and I hope we can all work together so we can help more patients and alleviate the burden of our public hospitals so that the majority of people will not have their healthcare services affected. Last question. I'm from Orange News. Secretary, the government said yesterday that it doesn't want to have drastic social distancing measures imposed in general. Now, if we have further tightening of social distancing measures, what are the radical ones? And now for a Stanford American school, what do you think is the route of transmission? Is BA.5 involved? Would that be a rather large cluster recently among schools? The new term will start very soon. Are you worried that there will be a major outbreak in schools? Will you have to tighten the vaccination requirement and also control of extracurricular activities? You are from Orange News. Secretary, all measures will be considered, but I have stressed a number of times that for measures that come with a higher social cost, we will try not to impose them as far as possible. But if the development of the epidemic is not that desirable, if it continues to worsen, we have no choice but to adopt these measures. We don't want to, but we can't rule the possibility of introducing these measures. I hope you understand that we are coping with many new infectious disease, from SARS to Ebola to avian flu to COVID-19 and even chicken pox. You have to understand that public health is an important issue, and we must be prepared. Even when COVID is under control, there may be new infectious disease, and in general, the government has to be well prepared. Dr. Zhuang, Stanford American School has a total of 22 students and 2 teachers confirmed. In our year out, there are 7 students. There are 21 classes in this school, and there have been positive cases in 14 classes. They use the same canteen for meals, and we suspect that there might have been some transmissions in the canteen. And the percentage of cases is a bit higher. And given that so many classes have got cases, to play safe, the school should suspend classes. When the new term starts, the daily RAT requirement on teachers and students will continue. And I think that is an effective way of stopping transmission chains in schools. When the community infection rate is high, then the same will be reflected in schools. This is to reflect the situation in the community. The daily RAT is to minimize the risk of transmission in schools. The PB ends here. Thank you very much.